Hi, I'm Ahmed Khan. I'm a neurosurgeon practicing in New Britain, Connecticut. I've been in practice for over 25 years. Not only do I perform cranial surgeries, but my practice also consists of complex spine surgery. The three words I would use to describe Catalyst is really easy, moldability, and uh, satisfaction. So the easy part of it is very easy for the staff to use. There's no preparation required. You could bring it into a case, open it, and you're ready to go. The moldability to me is very nice because you can contour this in many different places in the spine, whether you're doing occipital cervical fusions, thoracic fusions, lumbar, sacral fusions. It molds very nicely in the lateral gutters. I've used other synthetics that would disperse everywhere and you couldn't really contain them where you wanted. So I think the handling and the moldability is very good. And from the surgeon, you just get that satisfaction where it's a reproducible product. You can use it every time you use it, you're getting both the fusion results and the handling. So I think from a surgeon satisfaction standpoint, is a very high surgeon satisfaction. I've just recently switched to Catalyst and don't have long-term results, but I like the fact that OssDsign has confidence in their product to do prospective research studies. So the fusion rate in the registry, they have a very high fusion rate, as well as looking into doing prospective level one data. Uh, I respect OssDsign for having the confidence that they want to do these studies. So I think from my personal view, as I'm seeing these patients back and assessing them for fusion, I expect to see a very high fusion rate. My patient population in New Britain, Connecticut has several comorbidities. We have a very um, aging population, many diabetics, osteoporotic bone, a lot of revision surgeries, uh, and so I really need a biosynthetic biologic that uh, can help ensure good fusion success. What excites me most about Catalyst is just the ease of use. And I think in the case when you've had to put in a cage or prepare your fusion surface, you want a biologic that's easy to use, very reproducible, easy to pack in into the cages, and Catalyst checks all those boxes. It's very easy to use for the staff. It comes in the syringe. There's no preparation required, and so I like having that available as we're going through these multi-step procedures. Well, in my surgical workflow, I always try to use as much local autograft as I can from spinous process and lamina. And I feel the catalyst is very good to combine with autograph. So it integrates very well. Again, you can maximize how much you pack into cages. It flows very nicely, and it surprisingly, I think the price point was very good in bringing it into the hospital, and so that is quite honestly the main factor for me. How much work and how much do I need to do to bring in a biosynthetic and uh, try to be cost effective. And so that came in, and if the hospital's happy, the staff is happy, I can use it with good satisfaction, and my patient outcomes are good, then it's a win-win all across the board. Well, I think that if you're interested in using it for the first time, try to find a case where it's more of a simple one level case, and really learn the handling and get a feel for it, and use it, and then see how you like it. I think once you experience the handling, then you're going to want to use it more and more. I think that ultimately it's the fusion rate that we're concerned about. And so you just have to follow those patients. I think it's important to have data. And again, I think OssDsign has the confidence in their product that they're willing to invest and get data, real world data, to show the surgeons. And in my patient population, I think it's nice to have data that I know how does it work in diabetics or revisions or smokers. This is very important data to have. So I'm excited about using Catalyst and seeing for myself the outcomes I get.